Hello, and welcome to the JTech Medical Northstar Up and Running series. I'll be guiding you through how to get started and how to take full advantage of the features of this powerful new suite of functional assessment tools from JTech Medical. Northstar is a suite of modules designed to help you manage patient data, record functional ability, and create easy-to-read reports, all in a simple, intuitive, step-by-step manner. The Northstar software is modular, making it easy for you to customize it to suit your needs as a practitioner. This tutorial may cover some aspects of the software that don't apply to your particular configuration, but if you follow along, you should learn the workflow and the basics of navigating the software and be prepared to utilize any configuration you may have. The workflow through the software can be divided into 4 basic components: intake, evaluation, analysis, and report creation. In this tutorial, we're assuming you already have the software installed on your system and have already set up your database. But if you need help with this step, you can refer to your software manual or call JTech Customer Service for assistance, or refer to our separate video on Northstar installation and initial setup help video. JTech Medical Northstar software is capable of efficiently managing all of your patient health records for better usability and progress tracking. In Patients, you'll see that the software first prompts us to select a database. We can also open a database by clicking up at the top here. After we've selected our database, we can start adding or modifying patient info. First, note that we have a search field here on the left, as well as the ability to pull up the most recent patients for quick access later. We're going to add a new patient, so we'll click the Add button. You'll see here there are multiple tabs across the top that provide space to create a very detailed patient record. You can add as much or as little as you want. The only field that's absolutely necessary to start testing is the first name field, but in order for certain values to calculate properly, we'll need a little more info. So our sample patient here is going to be male, right-handed, and in his mid-40s. Let's click over to the Personal Background tab. Remember that anywhere in the software you see this icon, you can create custom list items. So if you don't see an appropriate built-in entry, you can always add the more common items you see in your practice. There are many fields here, and you can collect as much or as little information as you feel is needed in your practice. Here in the Medical History tab, you have fields for allergies, medications, past diagnoses and surgeries, and we can also make a note that there are no significant findings by clicking on the radio button here. If we click the Custom Lists button here, you can see that the software comes preloaded with common allergies, medications, and even some common diagnoses. Again, you can customize these lists to make the process as streamlined as possible for your practice. You can track family history here. Again, completely customizable. In Complaints, we're going to click the Add button to start a new complaint, and I'm just going to enter some quick information here. You can track complaint history to help determine if your treatment plan is having the desired effect as well. Let's go to Employment. This tab is helpful for the FCE, employer services, and post-offer clinics, but can be useful information even if you don't offer such services. Before we can begin testing, we need to create a visit. Click the Add button here. I'm going to select one of the default descriptions, but remember you can edit these lists at your discretion. Care providers. Information you enter here will auto-populate the contact info in your reports. If you don't add a care provider, the default provider will appear in your reports, and that can be set up in your Settings menu. We can also add detailed case information, and, as you'll see in many screens throughout the software, a field to enter any notes or observations while you progress through the software. Click the Save and Close button to continue. Now at the top of the software, you'll notice we have our current database, patient, and visit information. Clicking any of these fields will jump back to their respective screens, and we can also close out of our current patient or database by clicking the Close button next to each field. From here on, whenever we want to open a patient, we can simply click the Open Patient button to open our Patients dialog and quickly select from our current database. Objective physical assessment is a huge component of Northstar, and there's much more to the test section than we can thoroughly cover in this video, but we'll give you a broad overview of testing, then go more in-depth in a future tutorial video. Northstar has been built to work seamlessly with our Northstar Echo wireless evaluation product, but you can also enter data manually in almost any testing screen in the software. For the purposes of this tutorial, we're going to assume you already have your instruments registered. If you need assistance with this step, please feel free to contact JTech Customer Service or refer to your user manual for more information. So we have our database and patient file. Let's get into testing. Click Tests from the home screen. So you'll notice that Tests is broken down into 6 categories. The first is the optional module Quick Screen. Quick Screen is designed to get you in and out of testing as quickly as possible by performing a cursory evaluation to check a patient's general health status. You'll see that you can actually add a new patient right from within Quick Screen. This patient information will automatically create a patient record, which we can open in Patients and add any additional information we want. But for now, let's open our sample patient. You'll see that our test categories are broken down into upper strength, lower strength, and spine motion, and that there are 4 pre-selected tests under each category. Clicking on the test name here will prompt you to wake the device. Push the On button on the device you'll be using, and the software should connect automatically. If this is the first time you've used a particular instrument for the day, the device will prompt you to zero calibrate. Zero calibrate the device as described in the product manual, and click OK. Quick Screen gives us a quick and easy way to perform basic range of motion and strength tests, and also a very easy-to-access report output that documents any deficit the patient may have. This is especially helpful to help quickly justify treatment plans to the patient. Physical neurological. This section includes tests that primarily use lists, mannequin selection, or radio buttons, and can be based on observations, physical tests, and questionnaires. There are a number of default tests and questionnaires available to the user, and you can add custom tests to these lists using the Custom Test Manager by clicking here. Click the tests or questionnaires to add them to the test playlist on the left. The panel on your left, the playlist, is all of the tests you've added to this particular battery. You can add or remove tests as needed, or move tests up or down, which is helpful when, for instance, you want to group tests together to minimize patient repositioning. You can also load pre-saved playlists, such as common FCE tests or sequences specific to a particular patient by clicking here. We've got the Instrumented section next. Clicking Instrumented will bring up a selection of icons above the playlist that represents all of the instrumented device categories: inclinometry, muscle testing, algometry, static strength, goniometry, grip testing, pinch testing, and isometric testing. Each of these test categories will be covered more in depth in a later tutorial, but let's quickly look at the basics of test selection by clicking on inclinometry. Most of the instrument screens are similar to this one. You'll see a mannequin in the middle, and as you roll over the various body regions, you'll see a highlight. Clicking on each highlighted area will bring up a list of tests available in that region, and then clicking the test from the Available Tests box will add that test to your playlist. As you perform tests, you'll see results populate over here on the right, along with the result, the normative value, the difference to normative, and whether the test is considered valid by AMA or CV criteria. At the bottom, you can see a variety of settings: reps, validity criteria, the order of testing, and so on. In some instruments, you'll also see the ability to select tests by mannequin as well as by nerve root and even the peripheral nerve if desired. All of the instrumented and functional tests in the Northstar software include multimedia help videos which can help you and your patient understand how a particular test is performed. Clicking the camera button in any test will bring up the help video for that test. Related videos will appear in a drop-down here above the player controls. Close the video to return to the test screen. There's a lot more to instrumented testing, but again, for the purposes of this tutorial, we'll move on. On to functional. Clicking here will bring up some new categories above the playlist: activities, postures, material handling, dexterity, and cardiovascular. As you can see, each category contains additional tests. And again, you can manage custom tests by clicking here. One other important aspect of the test screen we haven't covered is the Functional Test Assistant. Clicking here in any of the functional testing screens will bring down a heart rate interface and posture tracking timers. Simply select a posture you want to track while you continue other testing, then start and stop the timer by clicking here. You can track multiple postures simultaneously, and all of this information is recorded and saved for inclusion in your report. Remember to stop your timers when the patient is no longer demonstrating that position. The hand section of tests is particularly useful for hand therapists and orthopedists. It includes observational data, range of motion tests, grip, and pinch tests also available in other instrumented screens. Also included is a physical sensory test that allows you to document sensory results easily by painting the model with the corresponding color for the sensitivity using monofilament or two-point discrimination. Finally, the last section I want to cover in test is possibly one of the most useful: test sequences. Test sequence allows you to quickly load previously used, previously saved, or even JTech provided default test sequences immediately into your playlist. You can reload previously created sequences quickly by clicking Previous Test Sequence here, or previously saved custom test sequences by clicking here. On the right side, we have a number of default test sequences created by JTech that create a quick test sequence for a variety of standard FCEs. Remember that every FCE is different, and all tests and questionnaires in the default sequence may not apply to what you're doing. If you use a particular sequence frequently and want to save it as a custom test sequence, click the Save Test Sequence button below the playlist to save it for quick retrieval later. That's about it for tests, but there's a lot more to it than we can thoroughly cover in this video. For more information on individual components, you can contact JTech Customer Service for additional support options. So far, we've created a database, created a patient file, and created test sequences. The analysis and report sections are where you're going to see the culmination of all of our work. Here's where you'll see the true potential of Northstar as a time-saving evaluation tool. The first thing you'll see when you open analysis is 4 categories on the left: test results, summary, test history, and acute whiplash. Test results is where you'll find data collected from all of the tests you've completed, which are available here for review, organized by device and body part. As you can see here, this gives you a quick, easy way to determine efficacy of treatment and progress. Data for any tests performed will auto-populate here. There's more to analysis than reviewing data, though. Let's click the Summary tab here. This section will be particularly important for evaluators performing functional capacity evaluations. You'll see a list of options in the list below: summary and recommendations, functional assessments, reliability of effort, reliability of symptom reports, and perceived function. Summary and recommendations is where you'll detail your final determination on the patient's demonstrated ability and your recommendation for the referral source. Anything you enter in these fields will show up under the summary header on your reports. If you're using the default template layouts, that means this information will be on the first page of your report, so it's an excellent way to get your determination at the forefront of your report. Functional assessment is where you can quickly update and review the patient's functional objectives, job demands, and demonstrated ability, and other functional capacity evaluation-related determinations. In reliability of symptom reports, you can make a determination of whether the patient showed appropriate responses during testing, and this section will also show you any data collected on subjective pain indicators recorded during testing. Reliability of effort gives you the ability to quickly note your determination of the patient's demonstrated effort. And again, like reliability of symptom reports, will collect any notes taken about high-effort behaviors during testing. Perceived function. This section allows review and assessment of the patient's reported perceptions about their own functional ability compared to their demonstrated or biometric results, such as rating of perceived exertion or spinal or hand function sort questionnaires. Test history will allow you to review test data for multiple visits to quickly review patient progress. You can select from a range of dates to include as many or as few patient visits as desired, and you'll be able to see changes between visits on a graph or as a percentage. The acute whiplash module is characterized by a number of categories identified by whiplash specialist Dr. Arthur C. Croft after review and analysis of nearly 2,000 cases of whiplash injury and whiplash-associated disorders. The guidelines provide an estimate of the duration of care as well as the frequency and number of visits that might be expected throughout the case. Care providers, third-party payers, independent examiners, patients, and others could all realize benefits in the face of complex whiplash-related cases. Take note, though, that these guidelines should only be used as a reference. Clinicians should use their own judgment and should look at all of the evidence in recommending treatment guidelines. The final module to cover is the culmination of all the evaluation data, questionnaires, and observations we've made throughout the software: reports. By default, Northstar gives you 3 options for creating reports: Narrative Express, Narrative Select, and Narrative Expert. Each option gives a certain amount of customizability to the final report, and all options create the report in rich text format, which is completely customizable in the word processor application of your choice. Narrative Express essentially imports all collected data and formats that information into a nice, legible narrative using the default narrative report settings, which are customizable in the Settings menu. Narrative Express is a good option if you're just starting out with Northstar or are unfamiliar with the report creation process. Use Narrative Select if you don't necessarily need every section of the report. For instance, if you're creating a summary report, or if you simply want more control over what goes into your report beyond what's created when using Narrative Express. The final option, Narrative Expert, gives you maximum control over the content and layout of your report. Click here to enter Narrative Expert. You'll see all the categories listed in the left column, and as you select a category, it'll give you the ability to select from the default options, as well as add or modify the narrative items in the pane below. The narrative template window on the right will maintain a list of every section you have selected in the order in which it will appear in your report. Once you've selected the options you want, you can save the selected options as a template. For example, if you have a referral source that prefers a particular report style, those custom templates will be available from the Available Templates list on the previous screen. The final section we'll cover in this video is forms. Northstar provides a number of standardized forms such as DOT medical report forms and others provided by independent medical organizations such as the AMA. Just like in the Narratives tab, any form you add is added on the right to the report template, and you can save the custom form list for easy future reuse. That's it for this tutorial. We could go a lot more in-depth with the JTech Medical Northstar software, but once you understand the functions of each module and the basic workflow through the software, you can begin to document physical ability or impairment, determine ability to return to work, and create detailed narrative reports more quickly and easily. We hope you found this tutorial useful in getting up and running in the software. If you have any questions, please call, write us, or visit our website to learn more.